Hello everybody, this is Carlos from Army of Nurses and welcome to another video. This is going to be our Pharmacology Series video. And the reason for the development of this series is because pharmacology is arguably one of the most challenging courses for nursing students. Every year around the world, there's millions of adverse events related to medications that can be prevented. And as a result, teaching pharmacology and understanding the pharmacokinetics and pharmacodynamics of it is extremely important for nursing students to be able to become safe practitioners. Now, teaching methodologies should actively try to engage students through the use of case studies, discussions, narratives, anything that allows students to apply their knowledge. And which brings us to the point that pharmacology and pathophysiology, they are very tightly related, and you cannot be successful in one without being successful in the other. Now, the purpose of these videos, we're going to cover pharmacology from a nursing perspective and not from a pharmacist degree perspective. We're going to focus a lot on nursing implications of medication administration. And the methodology that I'm going to use will involve case studies with small bundle of medications at a time in a commonly prescribed manner from a medical surgical unit, so that it becomes easier for students to build up their knowledge to pharmacology. Now, as always, prior to administering medications, we have to perform our 3 checks and our 8 rights. Now, the 3 checks are going to be check number 1, before we dispense the medication or before we take it out from the container and we check it with the MAR. Check number 2, when we're preparing the actual medication, whether it be taking it out of the container, mixing it with solvent and solutions, whatever the medication might be. And number 3, prior to administering to the patient, we're going to check the medication again. Which brings us to our 10 rights. Now, the 10 rights for medication safety, you want to make sure that it is the right patient, the right drug, the right dose, the right route, the right time and the frequency, that you are giving it for the right reason, that you are performing the right assessments and providing the right education and documenting properly. And last but not least, the right for the patient to refuse the medication. So let's start with our case study. Now, I'm going to keep it simple. So 54-year-old male admitted with fever, headaches for 2 days and nausea, no allergies, past medical history of high blood pressure, smoker, 1 pack a day, asthma, high lipids, vital signs, temperature 38.2 degrees Celsius, pain is 4 out of 10, respiratory rate 24 per minute, blood pressure 138/85, pulse of 110, and oxygen saturation of 94% on room air. We send the patient for a CT scan and ECG, and they're both normal. So the patient's medications that we're going to start with for this MAR, patient has been prescribed Acetaminophen, Salbutamol, Metoprolol, Dimenhydrinate, and Atorvastatin. So let's look at these medications in a little more detail. Now, Acetaminophen, brand name Tylenol, we're going to use it for mild to moderate pain and for fever. It belongs to the non-opioid analgesic class. And the usual dose for an adult, it's usually between 650 to 1 gram per dose every 4 to 6 hours, with a maximum of 4 grams in 24 hours for healthy adults. And if it's an elderly patient or a patient who has known liver disease, then we might need to cut it down to 2 grams maximum for 24 hours. It's a relatively safe medication. However, we should always watch for allergies. And Tylenol works by blocking prostaglandin synthesis, therefore preventing the pain signals from being transmitted from our nerves to our brain. And also, it affects the hypothalamus by lowering the core temperature, and hence that's how it helps with lowering our fevers. Now, some of the nursing considerations is if your patient has severe liver disease, we have to be mindful and we might need to reassess the need for Tylenol with substitutes. Avoid taking it with alcohol, because alcohol is also metabolized by the liver. And be very mindful that Tylenol is part of a lot of drug combinations. For instance, you have Tylenol and oxycodone, you have Tylenol and codeine, etc. So that amount of Tylenol in those medications should also be added to your maximum 24 hours limit. There's a high overdose rating for Tylenol because it is an over-the-counter medication. And one of the antidotes I want to introduce you to is called Acetaminophen with a brand name Mucomist, and it's something that we give intravenously to treat patients who have taken Tylenol overdose. We're going to perform a baseline assessment with our PQRS-TU, and after administration of the Tylenol, we're also going to repeat our pain assessment with the same scale. Our next medication we're going to introduce is called Salbutamol with a brand name Ventolin. We're going to use it for asthma. It belongs to the class of the beta-2 agonist, and agonist just means stimulant mostly. Now I put there that it's also a beta-1 agonist in high dosages, but it's mostly a beta-2. Now the way you're going to distinguish between both is beta-1, you have one heart, and beta-2, you have two lungs, and that's where those receptors are found, okay? Now the usual dose of the salbutamol is going to be about anywhere from 1 to 8 puffs in 24 hours depending on the patient. Some patients, they take it regularly, some patients only take it as needed, so that will be very patient dependent. Some of the adverse effects, they're mostly related to their the fact that it can potentially bind to beta-1 receptors and affect the heart, therefore leading to a fast heart rate. And with a fast heart rate, people can get anxious, palpitations, tremors, etc. And as any medication, we're going to watch for allergies as well. Now, the mechanism of action is it binds to the beta-2 receptors in the lungs, and it causes bronchodilation. As your bronchioles are dilated, meaning that they're wider, that means that more air can go in, and if more air can go in, it means more oxygen for the cells, right? So some of the nursing considerations we're going to include is if the patient already tachycardic, it might make the heart rate go even higher. So we have to be watchful and mindful of that. Assess if the patient has ever used puffers before. Do they have the dexterity to apply the puffers for themselves, or do they need assistance for that? We're going to collect a baseline vital sign, so we always have something to compare it to. We're going to do a reassessment after we administer it. And we're going to be careful with medications that also stimulate the sympathetic nervous system, because that can potentially lead to further increase in heart rate and increase in blood pressure. The next medication we're going to introduce is Metoprolol with a brand name Loprazole. Now we're going to use it for high blood pressure, for some fast arrhythmias, and for angina. It belongs to the beta-1 antagonist, and antagonist just means to suppress. The usual dose is usually between 12.5 milligrams up to maybe 300 milligrams in a day. And it depends on the patient's stability, depends on the patient's condition, and depends on how long the patient has been taking beta blockers before. Some of the adverse effects is bradycardia, so low heart rate, hypotension, drowsiness and unpleasant dreams, and watch for allergies. Now, some of the general mechanism of action is, like we mentioned before, beta-1, you have one heart, so that's where these receptors are. The metoprolol is going to block the beta-1 receptor from the heart. Therefore, epinephrine will not be able to bind to these receptors. And as we can remember, epinephrine is part of the fight or flight system, which increases heart rate and increases blood pressure when it binds to these beta-1 receptors. But now that the metoprolol is actually blocking these receptors, then epinephrine cannot bind to them, and therefore it cannot exhibit these effects, right? Now, some of the nursing considerations is we got to be careful the patient's heart rate is borderline low. So if your patient's heart rate, for instance, already 61, 62, then the metoprolol will lower even further. Is the patient blood pressure also on the lower side of things? So hypotension, it might be exacerbated if the patient takes different classes of antihypertensive. So we have to be careful with that. The other nursing consideration you have to think about is when we're trying to get the patients out of bed, ambulations, or the patient is going to engage in strenuous exercises. The reason why is because if the patient is beta blocked, that means the heart rate cannot go up to compensate if their blood pressure goes down. So be mindful of that, because then they can faint. Okay. The next medication we're going to introduce is Dimenhydrinate, brand name Gravel. We're going to use it for nausea, motion sickness, and I put there also for sleep, but not really, because then the sleepy part, it's one of the side effects. Now people use it as a sleeping aid because of its side effects. Okay. The class, it becomes it's part of the antihistamines with the antiemetics or anti-nausea medication. Dosage usually 25 milligrams to 50 milligrams by mouth, a maximum of 424 hours. Now, some of the side effects is going to be lethargy, drowsiness, dry mouth, tachycardia. Now, these two are related to its anticholinergic effect. And as always, we're going to watch for allergies. Now, how it works is because it is an antihistamine, it's going to block histamine receptor H1 in the vestibular system in your ears, and therefore easing the feeling of nausea and vertigo. So the vestibular system is one of the systems that actually causes nausea when it's triggered. Think about it like when you go into a roller coaster, and that's how you get nauseous, for instance, and that's where the vestibular system is. Now, some nursing considerations include the patient's risk for fall might be higher. And this is like a double-edged sword, because if the patient is nauseous, the risk for fall goes up. If the patient is lethargic because after you administer the Gravel, then their risk for fall will also go up. Now, if the patient takes any other sedatives, be mindful, because it might make the sedation even more profound with these additional sedatives, and if the patient takes alcohol on top of that. Consider giving this medication a different route other than by mouth if the patient is nauseous, and in this case IV, because if the patient is nauseous and might potentially vomit, if you give this medication by mouth, the patient just gonna regurgitate it back up and is not gonna get it. Now, as a fun trivia, did you know that about half of every tablet of Gravel contains Benadryl in it, and which is why it's causing the sedative effects? I thought it was a fun little trivia for you. And the last medication we're going to introduce you to is Atorvastatin, brand name Lipitor. We're going to use it for high cholesterol and high lipids. It belongs to the class called statins. The usual dose is between 10 milligrams to 40 milligrams by mouth. Sometimes higher if you have high cholesterol due to genetics. Some of the adverse effects include nausea, headaches, increased liver functions, and watch for allergies. In a rare situation, it might cause muscle pain, myopathy, but it's one of the rare side effects that it has. Now, the mechanism of action is it blocks an enzyme in the liver called HMG coenzyme reductase, which this enzyme helps the liver in producing cholesterol. Now, some of the nursing consideration is you're going to try to avoid giving it with grapefruit juice, because it increases the effect of Lipitor. It's usually given at nighttime, because at nighttime that's when your body produces the most amount of cholesterol. So this is when you can get the most bang for your buck, right? If your patient has liver damage or has any liver disease suspected, it should be hold and reassess. It increases muscle breakdown if taken with some immunosuppressant medications, back to our myopathy, our rare situation. And it can also increase the effects of anticoagulant drugs, therefore leading to increased risk of bleeding. And the reason is because if you think about it, the liver is responsible for producing clotting factors, right? So if that gets hindered, then your bleeding might be prolonged, and your body might not be able to produce enough clots for that. Now let's go back to our case study right now. So based on this, which of these medications do you think it's going to be effective in treating the pyrexia, headaches, the temperature, and the pain? You can pause the video and we'll give you the answer in a few seconds. Now, if you chose Tylenol, very good. This will be your medication that you're going to give that's going to treat the fever and also the mild pain. Next one. Now, which of the medications are going to treat the asthma and also the low oxygen saturation? You can pause the video and then we'll give you the answer in a few seconds. Now, if you've chosen Salbutamol or Ventolin, you are correct, right? This medication is going to help with the asthma and the oxygen as well through through a bronchial dilation. Okay, very good. Next one. Now, which of the medications do you think is going to help with the hyperlipidemia? You can pause the video and we'll give you the answer in a few seconds. If you've chosen Lipitor, very good. That's the medication that we're going to use to help the patient treat the high cholesterol or the high lipids that the patient has. Now, how are we going to treat the hypertension, which is the blood pressure 138/85 and the heart rate of 110? Which medication will you choose? Pause the video and then we'll give you the answer in a few seconds. If you've chosen Metoprolol, very good. That is the correct medication as it is a beta blocker. And that's going to help us with the high blood pressure and with the fast heart rate simultaneously. Now, which of the medications are going to help with the nausea that the patient presented? You can pause the video and we'll give you the answer in a few seconds. If you've chosen Gravel or Dimenhydrinate, very good. That's the medication that is going to be the most effective in treating the nausea, and hence it was prescribed as needed for the patient. Thank you very much for joining us at this time, and this is one of the first videos in our series of pharmacology intended to help nursing students become more confident and comfortable in learning medications. Thank you for watching and see you next time. Bye for now.